Hi, I'm Steve Stahl, and I'd like to talk to you about a new case book that's coming out. Now, this case book is co-authored by Kakesha Cooper and Jerry Maguire, who are colleagues of mine at the University of California, Riverside. Now, this case book came about because when I took a faculty appointment very recently at this university, because my friend, the department chair, Jerry Maguire, asked me to come over, I was struck with how they were an excellent clinical faculty. And this relatively new medical school has been set up to serve an underserved and much more diverse community in the eastern part of the Los Angeles and area. And so these are patients that are poor, often rural, more agricultural, more Hispanic, more African American, more Asian. So it's a diverse group of people, and as you know, we've been talking about it. It's a big topic today. How much we've been neglecting this group of people, and then neglecting the mental health practitioners of those same diverse backgrounds. And so UC Riverside has basically a mandate and a mission to actually close the gap in some of the problems that we're having with diversity. And I was attracted to that, wanted to help what I could. And so what we decided to do is to take our faculty, which is a very diverse faculty, and our residents, which are a very diverse group of residents, and our patients, which are similarly, and put them together. So every case comes from UC Riverside. Every case is written by a companionship or a partnership with a resident in training in psychiatry there, plus one of the faculty members. So we put those together. The format was established in my previous two case books. I helped, gather these. We did extensive editing of the cases, putting in the format, and trying to actually close that gap. But it's a general psychiatry case book. It's puts in some of the problems that occur in people who are underserved and neglected in our society, as well as having mental illness. And so we try to hit that, and there's a great deal of learning to can be done on that. And hopefully people will have a broader group of patients and of patient experiences as the basis of the case book. People who should buy the case book would be the people who learn by seeing cases, which is most active clinicians. If you're an ivory tower type that wants to look at multi-center trials and big data and data just from randomized stuff, don't buy the book. If you're a clinician who sees patients every day, this will help you, because what happens when you read a book like this, you say, oh, I've seen a case like that. That's a great idea. I didn't have that idea before. I have those things. I've been practicing a long time. When I read cases, I learn all the time. So case-based learning is particularly useful and attractive to active clinicians. So this is for people who see patients. And if you see patients, you need to see this book.